Good morning. Good morning, good afternoon, everyone. Thank you so much for joining. Just waiting for folks to join and come into the webinar. Welcome, everyone. Good morning, good afternoon, good evening, wherever you are. We're so pleased to have you today at this Health System Strengthening Learning webinar. We see people are continuing to join, so we'll just wait another 1 or 2 minutes. Welcome to those of you who are just joining. We're very glad to have you here today. Good morning and afternoon to everyone. I think we can continue. So Grace, if you don't mind going to the next slide. We want to welcome everyone today to this webinar on advancing the role of communities in health systems monitoring and measurement. So before we get started with our content, we're going to cover a few logistics and housekeeping issues. I see one message that someone cannot hear, but Rachel will give me a thumbs up or a nod if she can hear. Good, great. In the meantime, we also have interpretation. So if you would like to hear the webinar in French, please go to your interpretation icon and turn it on to French. Pour les collègues francophones, il y a une option d'interprétation. S'il vous plaît, sélectionnez l'icône français ou bien interprétation. As folks are joining, we also wanted to highlight that this is meant to be a participatory webinar in the spirit of community-driven monitoring and measurement of health systems. We have a few different ways to participate in today's webinar. First of all, you're welcome to enter any questions or comments in the Zoom chat, and we will have time after the discussion to take audience questions. Second, we will have some Zoom polls. So please be on the lookout on your Zoom screen for some poll questions to get some rapid feedback on your experience with this topic. And then finally, and you'll see this at the top of this screen, we have something called an idea boards. So this is a web link. We will put that in the chat when the time comes. And it's a space where you can add longer comments and reflections on what you're hearing. So we will put that link in the chat, and we encourage you to go to that link when it's time during the discussion to share your thoughts on the content that you're hearing today. Thank you. Next slide. So today, after we do a brief introductions of our wonderful panelists, you'll hear some framing on this topic from Rachel Marcus of USAID. Then we'll have a really rich moderated discussion hearing from our three experts and panelists on this topic of community monitoring and measurement of health systems. As I mentioned, we'll have audience question and answer, and then a final wrap up and call to action. Next slide. So I'd like to start by introducing our wonderful speakers for today. First of all, I'll introduce myself, your moderator. My name is Jessica Shear, and I lead monitoring, evaluation, and learning for the USAID-funded Momentum Routine Immunization, Transformation, and Equity. We have three amazing panelists to share their experiences of community engagement and community-led monitoring and measurement of health system strengthening efforts. From Kakamega County in Kenya, we have Imelda Barasa. She is a county nursing officer there and will share her wonderful experiences. From the DRC, we have Dr. Janaba Koulibaly. Janaba is the project director of the USAID-funded Momentum Routine Immunization, Transformation, and Equity Project. And finally, we have Duri Benin Haji, the executive director of the Youth Advocacy on Rights and Opportunities from Ghana. I cannot forget, of course, Dr. Rachel Marcus, the Senior Health System Strengthening Advisor from the Office of Health Systems at USAID. And with that, I'm going to pass it over to Rachel for some initial framing comments. Rachel, over to you.
Thanks so much, Jessica. It's great to see so many people online. I think we might all be collectively setting a record for HSS Learning Series participation. So we're really grateful to have everyone online today. If we could go to the next slide, please. Thanks. So I'll just be speaking for just a few minutes to highlight kind of why we're here today, what the learning series is, where we are in health system strengthening at USAID, and then I will leave plenty of time to turn it over to the panelists and for the input from all of you. As Jessica said, we're really hoping this can be participatory. We're really looking for your inputs and your ideas to help us take this agenda forward. So I will start by saying just high level health system strengthening at USAID. Where are we now? Where are we going? In one slide, the summary would be that we are working towards restoring essential health services to pre-pandemic levels by the end of 2025. And we do that in a number of ways, of course, but relevant to all of us today, and of course to myself sitting in the Office of Health Systems, is our health system strengthening investments that take us towards that goal. So part of our work to restore essential health services is, of course, foundationally to strengthen health systems and invest in health workers. And that is an essential step, which, as will not be surprising to anybody on the call today, towards strengthening primary health care, advancing global health security and health system resilience, ultimately helping countries achieve their universal health coverage goals, and renewing progress on the SDGs. Really, health systems are foundational to reaching all of these goals. And so we are excited about our increasing investments in this space. Next slide, please. So in particular, what we're launching today, and we're so excited to be doing so, is our 2024 Learning Series. This is our second year doing the Learning Series. It's an initiative of the Office of Health Systems to convene HSS practitioners to share and learn and use HSS evidence to inform our collective efforts to support sustainable health system strengthening. And so the Learning Series has a series of specific goals. It's to share evidence and knowledge that contributes to the HSS learning agenda, and I'll talk more about that in the next slide, with the goal of strengthening the global HSS evidence base and accelerating achievement of our shared global health goals. It is to update and really synthesize and disseminate evidence related to key areas of HSS practice to strengthen our programs, and to facilitate sharing through this series of tacit knowledge that's not otherwise captured in other capacities from a variety of sources, including all of you on the line today, which is part of why this is structured in such a participatory manner. So those are the high-level goals for the series. Next slide, please. And in 2023, it was a USAID-driven series. We covered a number of really interesting topics, but what we heard was that there was real interest from the broader community in being able to lead on some of these webinar sessions. And so we've opened up participation for this 2024 series to the community. We really welcome webinar ideas that advance learning on HSS and are likely to be of significant interest to the global community. We sent out an initial call for webinar ideas in December. We're reviewing suggestions on a rolling basis, and we're roughly scheduling about once per month, although we might add a few more where there's more interest. So we're working on the February webinar details, but I'm actually thrilled to let you know that in mid-March, we have finalized a session with the CHISU project on finding common threads in the interoperability journey, lesson learned from program implementation in 5 countries. And that will be related to our learning questions related to sustainability and scale. How do we best institutionalize and implement at scale the good practices that we're seeing best improve health systems outcomes? So look for more information on that soon. And if you would like to suggest a webinar idea, please reach out to hsslearning@usaid.gov. You can reach us directly. We'll let you know what you need to submit your idea. If you are not receiving the call for webinar ideas, if you are not receiving other communications from the USAID HSS network, you can also reach out to hsslearning@usaid.gov and we will add you to our network. So you will receive things like this call for ideas and all other communications that are coming from USAID Health Systems Office from the network going forward. So hsslearning@usaid.gov is your key email for webinar specific ideas for the rest of our series for this year, as well as to be added to our listservs. So we're really excited for the session today. And yes, I'm seeing questions in the chat, so I'm just copying it again. HSS Learning at USAID. Here, that had a typo. HSS Learning at USAID.gov is the address. And if you can go to the next slide, please. We'll put that back in again at the end of the session, so you'll see it. Today's webinar, we are so thrilled to really be able to focus on the role of communities, the central role and leadership of communities within HSS monitoring and measurement. And this connects to multiple learning questions within our learning agenda. So the learning agenda is a series of 6 high-level questions that are quite topical, where we are hoping to strengthen and build the evidence base. It is centered around USAID's Vision for Health System Strengthening 2030. Many of you on the line whose names I see participated in the development of this learning agenda back in 2019 and 2020. And we are really excited to use this series to help continue to advance our work to strengthen the evidence as relates to these questions in particular. So my colleague Anjali has just dropped the link to the learning agenda in the chat, and you can click on that to see in detail the approach of the learning agenda and all 6 of the questions. But today's session focuses in particular on 2 of the learning questions. Question 3 within the 6 question set focuses on what measurement tools and approaches are most helpful in our HSS monitoring and measurement. So how do we best understand interrelationships and interactions between different system functions as we work to strengthen the system cohesively? How do we best estimate the impact of our HSS interventions on health system level outcomes and our priority health outcomes? And again, this all links back to the key themes of the vision for HSS and to the high-level goals that I articulated up front around advancing primary health care, achieving universal health coverage, strengthening global health security and system resilience, right? So how do we strengthen our measurement approaches in HSS? That's question 3. And then question 5 is, what are some effective and sustainable mechanisms or processes that best enable the participation, but also the leadership of key local organizations and members of the community in leading on developing locally led solutions to improve high-performing healthcare, and how can we best support and center that work, especially for leadership of marginalized and poor and vulnerable populations, for local communities, for the full range of actors within the whole health system. How do we best conduct our work enabling those communities to lead? And this links obviously more broadly to USAID's localization agenda. And the topic in particular today is really resonant with that theme as we focus today on how we can best engage communities directly in monitoring and measurement efforts. Next slide, please. So here's a couple of terms that you'll hear today. I won't spend a lot of time on this, but we just wanted to ensure a kind of shared baseline. So communities are commonly defined as groups of people with shared interests, social interactions, norms, or location. And when we talk about community participation, there's some examples here that could range from mobilization efforts to, of course, empowerment efforts, but really is a process of developing relationships that enable stakeholders to work together to address health-related issues, and in this case, health systems-related issues. When we talk about social accountability, those are the efforts to ongoingly have meaningful collective engagement with public institutions for accountability in the provision of public goods. And lastly, community-led monitoring in particular is a common social accountability strategy. So a strategy for that meaningful collective engagement for accountability, in which communities are able to, in different ways, monitor the performance of the health system. And my colleague Jessica, who's moderating today, we worked on a version of this slide of the ladder of citizen participation. On the left, you can see kind of the traditional ladder going from simply being informed all the way up to delegated power, power delegated to communities. On the right side, you'll see some new text where we've kind of mapped what this looks like for community-led health systems monitoring, moving from simply being informed of measurement, communities being informed about measurement priorities approaches, a very top-down approach, all the way up through community-based participatory research, participatory action research, and at the kind of top of the ladder where we're hoping to center our efforts is really community-led monitoring. So that's what we're going to be talking about today. Next slide, please. I'm seeing questions in the chat. Yes, Kath is confirming the recording and the slides will be circulated to everyone who wants it. So this is my last slide, and then I will happily turn it over to the panelists. The learning objectives for today's session is to first describe examples of how communities are engaging currently in HSS monitoring and measurement priorities and approaches. And we have some wonderful panelists that we hope will be interesting and informative for everyone online. And also to discuss and really hear from you all actionable strategies for supporting local communities to not only participate in, but to drive the measurement and priorities and approaches that we are all working towards. So with that, I will pause and turn it back over to Jessica to kick off the panelists. Thanks so much.
Rachel, thank you so much. That was fantastic. What a wonderful framing on this topic, this really, really important topic. So Grace will actually stop sharing the screen because we are going to have our panelists come on video and start our discussion. And I'm so excited to kick us off. So a couple of reminders about the different interactive features we have. First, we're going to do a Zoom poll. And then we are going to share the link to something called an idea boards so that when our panelists are speaking, you can go into that web link, you press the green arrow to add your idea to the board, and you'll see some key questions up there. So we'll get there in a second. But before we get to the idea boards, Grace, can you launch the Zoom poll, or Amy? So everyone should see a question on their screen. We want to get a sense of we have 370 people on this call right now. So how much experience do you have in community monitoring of health systems? So 1 is really no experience at all. 5 is a lot of experience. You're an expert in this topic, or you've engaged in community monitoring of health systems quite extensively. So please check one of the options that you see in front of you. We're really excited to see what we're starting with today, and it's okay if people don't have experience. That's why we're here, to listen to our wonderful panelists and learn from them, and also receive some tips and tricks and other resources. So flagging to Amy or Grace, I can still see the poll question, but not the responses yet.
Jessica, this is Amy. A lot of people are answering the poll,
Wonderful.
and so far, the most popular answer is 3. So it sounds like about 28% of our attendees have some level of experience in this particular topic. When we get to option 5, about 10 people, 10% have experience in this area, and about 25 answered 1 with little to no experience.
Okay, so we are here to learn today. So this is just perfect. This is fantastic. Thanks so much for that update, Amy. And so just a quick note on the ideas board. So our colleagues will be putting the link to that board in the chat in just a second. And please click on the link. You'll go to a web browser. And as I mentioned, you can add your comments in these little sticky notes on the boards. You can see that Catherine just put the link in the chat. So please go ahead and use that, and let Catherine know if you have any questions in the chat, and she can help with that. So let's kick off this wonderful, wonderful discussion with our panelists. So we're going to start with hearing a bit of experience from our panelists when it comes to community monitoring and measurement of health systems, because all of these speakers have real world examples of how communities are involved in monitoring or measuring health systems. So we are going to start with Imelda. Imelda, as I said, is joining us from Kakamega County in Kenya. And Imelda herself, of course, is a nurse and she's a manager in the health system in Kakamega. So, Imelda, it is so important to have health systems managers like yourself involved in these conversations. And we want to know from you, how do you work with community members to monitor or measure your health system?
Okay, thank you, members. I'm Amelda from Kakamega County, and I want to share our experience on how we engage communities in health system strengthening in our county. We have really involved our communities in our health matters. We use community-based organizations and non-governmental organizations so that we are able to engage communities, identifying the gaps that are affecting their health from the community and even at the facilities, level 2 facilities in the community level, and holding the county government. They hold county government accountable for the gaps that are in our facilities and ensure that those gaps they are really handled with the county government. And even after identifying these gaps, the community members will allocate these interventions to relevant stakeholders in the county and even the national in Kenya, so that ensure that our health system and service delivery are of quality care. Thank you.
Imelda, thank you so much. And before I ask a follow-up question, just a reminder for folks to please put any questions you have in the chat, or please put any comments, questions in the idea boards link as well, which can gather those and sort those. So Imelda mentioned how in Kakamega they work with CBOs and NGOs to then forge these linkages to the communities. And Imelda, it's wonderful to hear this example. And I know that you've also mentioned that, as you said, you use scorecards and other monitoring approaches to identify those gaps and to create action plans. And Imelda, have you noticed any changes as a result of these actions? So when a community fills out a scorecard together, when they work with the health system to create an action plan, does any change occur? Can you tell us about that?
Thank you. Actually, as a county, we have seen a lot of changes taking place. Mostly, like I want to say, like finances or budget allocation to health has increased as a result of community engagement, and this is very key also. And also, when we look at how now the problem solving system in our health facilities has also improved because of the engagement, continuous engagements between the community members and the health facility staff. And this has really improved our services and even our personal relationships or interpersonal relationships between the healthcare workers and the community members, which is very key. And also for another one, an advantage that we have seen through community engagements and social accountability, there is also employment of staff, because the major gap that was also coming out was a shortage of staff in the level 2 facilities. We had even facilities had one staff or one nurse covering a big facility. And through that, the county has been able to recruit and deploy staffs in those facilities, which is also an advantage to us. We have also been able to implement facility improvement fund policy, which was there and had not been implemented. And through community engagements and community participation, and even this social audit, we have been able now to, the new governor has been able to sign, and we are now implementing facility improvement fund, meaning that spending the money at the source. And this has really also improved our service delivery. That is in level 4-5 facilities. And when level 4-5 facilities have improved in services, then it means also level 2 facilities, the services will be improved. Thank you.
Thank you so much, Imelda. So on the topic of community accountability and social accountability mechanisms like scorecards, we're going to just project a quick slide that shares some resources for the audience to take away, and we'll share all of these slides with you at the end of this webinar. But we just wanted to highlight a couple of things. First of all, a community scorecard is an excellent participatory tool to help, citizen-led monitoring of health system performance. And the second thing we wanted to highlight is the excellent USAID funded resource, the HSS Evidence Gap Map. So if you go to that Evidence Gap Map website, you can find many different published articles on different HSS topics, including on community scorecards, such as what Imelda was discussing. And so we've just highlighted one really excellent article here that you can feel free to read and learn from, related to community scorecards, and this is from Uganda in particular. So let's go back to our panelists. My next question is for Haji. Haji, very interestingly, and we're really excited to learn from Haji because Haji's organization engages youth community members to monitor the health system. Haji, can you tell us more about this?
Thank you very much, Jessica, and good afternoon to everybody on this call. I work for an organization in Ghana, specifically Northern Ghana, and over the past years, through the partnership we have with our Momentum partners, we use community scorecard, as Imelda also stated, to generate evidence through the use of the scorecard by young volunteers in our communities. And so through the scorecard, these young people are able to dialogue, to follow up, and to network with Ghana Health Service staff, parents, religious leaders, and other important stakeholders like the media, as a way of monitoring and improving the health delivery services for the youth from our community to the regional level. And so once young people themselves are leading these activities, it gives them the confidence and also bring on board all the stakeholders to also know that young people can lead. And that is giving us a lot of results. Thank you.
Thank you, Haji. It's really, really inspiring and motivating to hear that young people can lead change in the health system and that they can be part of monitoring a health system that's more responsive to their needs. So we'd love to hear a little bit more from you. What changes have you seen as a result of youth-led social accountability and community monitoring? Thanks.
Thank you very much, Jessica. I will mention a few of them. One, we've now seen that Ghana Health Service staff are very responsive to the needs of young people in monitoring health service delivery, especially on family planning and reproductive health. Also, through our most significant change activity, after action reviews, we have heard stories that inspire us and to give us the confidence that confidence building between young people, Ghana Health Service staff, and other stakeholders is yielding results. As a result of young people now visiting our health facilities regularly, more parents are coming on board and buying into the idea of allowing young people to access family planning and reproductive health services. Also, we are now recording more usage of commodities that young people hitherto were not having access to. And so based on this, Ghana Health Service being responsive, parents coming on board, and young people themselves having the confidence to walk into health facilities and have access to health delivery and to give feedback to the Ghana Health Service staff about the type of service they are delivering, we think that this is a significant change and that we want others to come on board. Thank you.
Thank you so much, Haji. And we're getting lots of questions for you in the chat. And so just to let the audience know that we'll be coming back to many of those questions, and we see some common themes there. One of the questions was related to more dissemination on your work. So if we bring up the next slide, we have another resource to share. And this might not be exactly the evaluation of Yarrow's work, but this is an excellent landscape review of youth social accountability. And so I really liked from this review that the authors said that these experiences with youth-led social accountability and community-led monitoring are racing ahead of documentation. There's really so much out there, but there are opportunities for us to learn together, understand what's working, and to work together on these types of mechanisms to increase the responsiveness of health systems. So again, all of these slides and links will be available, but I encourage you to read this particular momentum landscape on the power of youth voices. And I think our colleagues have put some other resources in the chat as well. So Haji, thank you so much. So turning it over now to Jeneba, a question for you, Jeneba. Jeneba has been leading a project in DRC called Momentum Routine Immunization Transformation and Equity. And particularly during COVID and the COVID pandemic and COVID vaccination, the project engaged a wide range of community members and non-traditional partners to help increase demand for the COVID vaccine. And that work is continuing into routine immunization. So Jeneba, I wonder if you can say a little bit about how these non-traditional partners and community organizations are contributing to monitoring efforts of the health system. Thank you.
Thank you, Jessica. So can you hear me well?
Yes, you sound great.
Okay, since I have been introduced it, so this is, I will be talking about the non-traditional partner work. So how do they contribute to the monitoring and evaluation process? There are various levels of this contribution. So first of all, let me just come back to how we convene or engage with this non-traditional partner. It is through a structured approach. We start by identifying them within the community, followed by interview to better understand their ability, as well as their availability to assist. Then is followed by a co-creation process that we assist the EPI team to conduct using data for decision making. So all the co-creation is based on what are the challenges, what are the main causes to the lack of covering all the children in need in a given area. So based on that, we've come with a kind of roadmap. The partners engage themselves to be able to contribute in order to assist and improve the number of zero-dose children or unvaccinated children, under-vaccinated children. So they did it through their own participation to monthly performance meeting by providing spaces for data monitoring and review meetings, by providing coffee breaks, but by also being part of some critical issue. In DRC, for example, we have a serious issue with electricity. So sometimes the healthcare workers might be struggling to even get to record on regular basis on time data in the DHS system, which is we are using here for the health system. So the main contribution, for example, in one of the health zone was providing a solar kit to assist them to be working instead of traveling far to seek for help and in order to get this data entry. They also have a women association visiting family in conflict area to identify unvaccinated or under-vaccinated children and women. And based on the data, they are analyzing or they are getting from their collaboration with the health system. We also have a community group participation in community polio surveillance by actively reporting back acute facet paralysis as a key activity for polio case surveillance. Non-traditional partner, contribute to search, active research within the community and link to immunization services with under and zero-dose children from their socialized structures as mosques, churches, and others. And lastly, partners integrate immunization services within their existing healthcare private clinic in order to reduce the distance to time get immunization services contributing in reaching more zero-dose children. So mainly what I've been sharing is based on the data used. They know just this share with them the critical challenges, the barriers, and the commit to be contributing in monitoring it, closely monitoring it, and to increase and overcome the barrier.
Thank you,
Thank you.
Jenniba. Really interesting examples. I think Jenniba's examples highlight different ways that communities and civil society organizations and local community-based organizations can be involved in monitoring. I particularly like, I'm a data person, so I like the example that local community members are helping with the Ministry of Health's monthly data review meetings, right? Helping to provide electricity, a space to hold the meetings, paper to print on. And so those types of in-kind resources are really interesting. Jenniba, there's been a lot of questions in the chat about how you and how others motivate or encourage community members and non-traditional partners to become engaged in the first place. And I wonder if you can share a little bit on what motivates communities to become involved in health systems monitoring. Thanks.
Yeah, well, this is a very important question we always get. So this is, it comes from the trust we had. We convened with this organization they are among the list of organizations. So we did identify them based on what they are already commit to do by themselves, which are sometimes not have something to do with healthcare services, but they are like, it has been shown in some of the slides that the definition of communities. So they are already organized. They might be working on malaria, something else, development issues in the communities. But because of the importance of immunization of this challenge we are facing, we engage them in the discussion. So based on the data and all these important, they decide to trust and we start a trusty process. And these communities, because they are already well known and they are also trust, the fact that they are contributing and trying to mobilize in addition to what the healthcare centers or healthcare workers are doing, it became a very strong partnership between community and health facilities to lead to the well-being of the communities, being the children and the women being placed at the middle of the sport. And we also have like some kind of recognition from the health authorities who involve these partners to big events, leading to their visibility and public recognition also. They are contributing even beside what we're committed to do when they felt respected and trusted. And we are very happy with some of them. And we are monitoring better to see how we can also be recognizing them well and document how this motivation can also be shared across with other countries or other partners, other regions. Thank you.
Yeah, thanks so much, Jenniba. And actually, I'm looking at the ideas board. There are a lot of really interesting comments and questions, reflections on the idea boards. And I want to read one out, which is really related to what Jenniba was talking about. And then we're going to share a slide. So feel free and share our next tips and tricks slide. But someone wrote on the idea boards and it got 8 votes. Involve communities as much as possible in the development of projects and not just mere recipients of aid. And so that really aligns well with USAID's localization agenda, but it also aligns very well with USAID's collaborating, learning, and adapting approach and the toolkit that goes along with that. So I highly recommend taking a look at this locally led development spectrum and checklist tool. And this can help projects think about are you adequately engaging communities from the very start of the project, and thinking about how communities are not just engaged, but as Jeneba described in her first example, leading the monitoring efforts, leading the prioritization of measurement questions that you have as part of a
Exactly.
project. And this is a great resource, a really simple checklist that should be helpful for your work. So I'm going to take some questions from the audience that have been coming in through various mechanisms. So if we go back to our panelists, we were receiving a lot of questions about sustainability of these approaches. And so Haji, I'd like to ask you about sustainability and institutionalization, particularly how your organization or other local CBOs are helping to sustain the work of youth, youth engagement, youth-led monitoring of health systems. Can you tell us a bit about sustainability and institutionalization of those approaches? Thanks.
Okay, yeah. So thank you very much, Jessica. For us in Yarrow, and with what we've done with our Momentum project over the past years, we work closely with Ghana Health Service and other stakeholders. So right now, Ghana Health Service do have district annual general meetings, regional annual general meetings. And so with this collaborative effort, young people have space in these annual meetings, which has now become part of the Ghana Health Service system, that at annual meetings, young people are given space to share evidence and what they can collectively contribute to make service delivery better for young people. Also, the culture of accepting inputs from young people as a feedback through our social accountability mechanisms at the community level. And so when young people, after the scorecard, move to the facility, they are able to give feedback to Ghana Health Service staff, not only Ghana Health Service staff, even to their parents. So it's become a culture at the facility level that it is acceptable to get feedback from young people with regards to service delivery. Additionally, community volunteers that we train are young people. That ownership of monitoring and holding service delivery staff accountable is now a culture. It is part of the community-owned setting that community volunteers that are young people will continue to live in the community, pass on this knowledge to other young people, to hold stakeholders, Ghana Health Service staff at the community accountable. And this will continue as long as young people continue to be part of the system as we have pushed. And this has helped greatly. Yeah, thank you.
Amazing. Thank you so much, Haji. Really, really interesting to hear about that. Hopefully lifelong commitment, right? That goes both ways. Imelda, we had a couple of questions that I think are relevant for you. We had some comments and questions that community-led monitoring is great. Communities can tell the health system what they need, but the health system also has to have the resources to implement these changes. And Imelda, folks are curious, in Kakamega County, where does the county get the resources to implement these facility improvement plans, for example? Can you tell us a little bit about that side? Thanks.
Okay, thank you. Yeah, first of all, for sustainability purposes, the county government has taken up the role of doing social accountability in the community. We have ward administrators in our various communities. These ward administrators are also attached to the health facilities at the lower levels, that is level 2 facilities, and they hold monthly, quarterly community social accountability. And then for the resources where the county government is getting resources, they're getting resources from the increased budget allocation that to health. So that is where they are getting the resources. And the level 4 facilities, they are having facility improvement fund where they are getting they are using or spending money that has been generated in the health facilities. So for sustainability purposes, the county government has taken up, and for the resources, it's just the finances from the national government trickling down to the county government. That is what we use. And the level 4-5 facilities, they use facility improvement fund. Thank you.
Imelda, thank you so much for kind of describing how communities are also helping to make resources available or advocate for increased budget and increased spending in health, which helps then to implement the changes that they're also advocating for. Jeneba, we also have a couple of questions and comments about trust. And Jeneba, can you tell us how might community engagement in health systems monitoring influence trust in the health systems? Have you seen any examples from DRC where this is happening?
Yes, we were luckily, let's say, we approach the momentum projects MRIT is using is leading to develop this trust. And, you know, in DRC, because of a lot of issues and, you know, which is it's a country with a lot of challenges, but the health system have been doing what they can do to help and assist. But the trust need to be key and showing case, sharing, let's say widely and also regularly some of the results and jointly monitoring the roadmap of the agreement, let's say, process we developed in the co-creation have been very helpful in maintaining this trust across the country, the communities, and it is now leading to the sustainability part, because as you know, as a partner, we don't work to implement ourselves, but we assist technically to implement. So we assist the health district, health directory to work through community. We assist the communities also to be able to show more they can do and to develop more what they can do in order to assist and make sure that the population, you know, with COVID, immunization services was very difficult to accept in this context, especially when we came with the COVID vaccine. DRC was among one of the last countries with very low coverage in vaccine coverage. So we have to be doing more, let's say, sustainable communication and building on this trust to overcome the challenge and increase, you know, this coverage, which have been impacting also the routine immunization services, which were already, it was good, but it was still under what we expect it to be. So trust is a main key point we need to be building on. And based on what we have learned, we do put in the balance when you discuss with them, what is the added value of what we are doing is about life-saving, and life-saving intervention like immunization service targeting mainly women and children within a community when they are well explained to them, when it is taken over by trusted organization, we saw increased adhesion and engagement from the community. And also it is important to highlight and mentor. And we are seeing also some kind of collaboration among us as partners, USAID partners, but also beyond us with other partners in presence, and also sharing this experience with other countries who have been willing to us to share our experience. So trust is key, and
Trust
it's
is
built
key.
through. Yeah, thank you.
Trust is key. Hadji, would love to hear from you because it's particularly interesting to think about youth engagement and involvement. How does this lead to changes in trust? Do youth now trust the health system more because of these mechanisms?
Sure. Thank you, Jessica. for the areas that Yarrow operates, hitherto, we realized that from our baseline and surveys, we gathered information that young people did not have confidence in Ghana Health Service staff, and so they were not going to the facilities. So we went out there to ensure that young people themselves lead the process to build confidence between themselves and Ghana Health Service staff and parents and religious leaders. And so we engage in a number of dialogue meetings, follow-up meetings between young people and Ghana Health Service staff. And Ghana Health Service staff came to the realization that young people were not coming to the facilities because of the low level of confidence. Because young people felt that if I went to the facility, the next day, my father, my mother will get to know that, yes, I came to the facility for family planning, so they were not going. So we were able to build that trust through these networking activities where young people are allowed to sit in meetings where their parents also present. And so parents also got to be very well informed about the benefits of certain service delivery like family planning and reproductive health. And this has built that trust that young people were not having. And so because of this trust, there is a high level of visitation of young people to health facilities because they know that if they visit the health facility, everything that happens there will be confidential. And that is working greatly to the benefit of young people and communities. And so with this trust, the level of confidence and information flow between young people and Ghana Health Service staff and parents has increased. And that feedback mechanism is helping greatly for Ghana Health Service to also adjust to the unmet needs of young people when it comes to family planning and other health service delivery. So I can say that if you bring parents on board, religious leaders on board, young people themselves leading the process, staff of health service delivery become more responsive, and that inure to the benefit of the community in general and to young people as the key beneficiaries of this trust.
Thank you
Yeah,
so much,
thank you.
Haji. Thank you, thank you. It sounds like as monitoring data or measurement data or evidence become more transparent to everyone involved in health systems, then we build trust, right? Because nothing is hidden. It's more transparent. It's open to everyone. So I really, really like both of those examples. We also have a lot of questions about scale up. So I'd like to ask Janaba and Haji, you both work for, not for the government, you both work for projects or community-based organizations or NGOs who receive funding from donors such as USAID. Do you think that these community-based monitoring approaches that you're so actively involved in, are these scalable by governments? Can governments take these to scale? Maybe just a quick, 15, 30-second remark on that. Janaba, go
Yeah,
ahead.
thank you so much. So yeah, we can say easily that it is something we can extend. If the government is even willing to extend it, it's hard to how they have seen it, and we have been pushing them to own it. So it is their ownership, and we are even asking to learn more at the central level. Secretariat General of the Ministry of Health is the key the board, and they are trying to push to see how they can extend it. And this is important to know that the fact that we are sharing and the accountability of this organization we are convening or engaging within their own community for their own health is leading to this way of thinking to extend it. So it is something feasible, and we know USAID is always with us, do care about it. We will continue to push and further document it to be able to share it widely. Thank you.
Haji, what do you think? Quick take.
Yes, I think these monitoring measures and contributions to social accountability mechanisms are scalable. In my case, especially where we've seen the results when young people lead the process, we think that our government can scale it up to other areas where young people themselves are allowed to generate the evidence and to dialogue with government institutions to bring results. So for me, young people leading the processes of addressing gaps that affect them, for me, is scalable, and we've seen the results, and we think that it brings about responsiveness and it leads to change for good health delivery for all.
Thank you so much. Amelda, final word from you. What is the biggest lesson you've learned in involving communities in monitoring the health system?
The biggest advantage.
The biggest lesson you've learned. What's one key takeaway you can share with this audience?
I know it's best. I've not been able to get the question so well.
Amelda looks like she's in transit, so we'll make sure that we include her response in the follow-up.
Yes.
Geneva, quick take, 5 seconds. What's the biggest lesson you've learned?
Yeah, thank you so much. The biggest lesson we have learned from this process, which is still ongoing, is that you can go from, a little bit of, we start with COVID, and it has been extended to all the, our MRIT project implementing technical domain like polio and routine immunization. So we did learn that having these partners, putting the health system and the community together as partners through this approach is leading to a strong and sustainable approach to also assist better, and by getting a service delivery to the most vulnerable within the communities for life saving. We
Great.
do also care about the fact that their role, we as an immunization project are leading it, but we are pushing it to be in the service of the primary healthcare instead of only focusing on immunization. So we have already some example where these approaches are extended to support the primary healthcare in general. Thank you.
Wonderful. Thanks, Geneva. So it is possible. That's what I took away from that. It's possible to do this. Haji, what's your biggest lesson learned?
Yes, my biggest lesson learned is that when in health service delivery, especially for young people, um, community involvement, bringing parents together to be transparent, for them to know that this type of health service delivery will benefit their children rather than destroy them. So in dealing with young people, transparency and allowing young people themselves to be at the center and speak for themselves works very well. And so that is my biggest lesson.
Wonderful.
Thank you.
Thank you so much. I love the theme of putting people at the center, which is what we should be doing for all of health system strengthening. Well, with that, we're going to do two things. We are going to project an evaluation poll because our time is almost over. So we'll put up that Zoom poll for an evaluation of this webinar to get a sense of whether you will use these approaches that you learned about today in your work moving forward. And then we'll also share one final slide as a reminder. As Rachel said earlier, if you have ideas for a session in this HSS learning series, please send them to that email address at USAID. And most importantly, I want to thank this amazing audience for all of your amazing comments, reflections, and questions. Everyone who is registered for this webinar will receive the recording, a synthesis of all of the chat discussion that was happening, a copy of the idea board synthesized. So there's so much amazing content that came out of this discussion. So just a huge thank you to our wonderful listeners and participants, and then a big, huge thank you to Jeneba, Haji, and Imelda for sharing your experiences with us today. So thank you so much, everyone. Thank you for joining. Thank you to Rachel and USAID.
Thank you as well from my end,
Thank
and
you.
please ensure you
Thank
email
you.
to be on the list, as we are drawing from your wonderful ideas and input for future sessions as well. So thanks again.
If you did not register, just put your email in this chat and we'll make sure that these materials are sent to you. Thank you so much, everyone. Have a wonderful, wonderful day.
Thank you, Jessica. Have a good day too.
Thank you. Bye-bye.